Welcome back to the class podcast, The Patient Voice Amplified. I'm Adam Charrington. I'm happy to be with you again. We're here with my partner in crime, Dan Check.
Nice to talk to everybody again.
Dan, here we go. Another opportunity to talk about the patient's voice and how do we make sure they're heard more in healthcare.
Yeah, I'm really excited for today's guest. You want to talk a little bit about who we're going to be chatting with?
Yeah, I'm excited as well. Dr. Rasu Shrestha, you know, he's a longtime friend of class and just an amazing person, number one, but obviously a very influential leader in healthcare. When I think of Rasu, you only have to say his first name. He's like Bono or Sting. You just say Rasu, and everybody knows who you're talking about. He's usually guiding the market on all things healthcare. You see him at most conferences. Just an amazing person, a longtime friend of class. So that's going to be great.
Yeah, that will be a fun conversation. You know, before we get to that interview, we always like to start with some of the things that we're hearing in our recent conversations. Do you have anything that stood out to you?
I do. This is a comment that came in from some of our patient portal research. Emphasize the word patient there, of course. It's someone that's having a lackluster experience, but what caught my eye is the vendor is actually helping the patient directly, which we celebrate, right? Listen to this. This provider told class, when patients have questions or need assistance, they can call the patient portal vendor. From time to time, we have patients calling us back or shooting us emails to say their experience with this vendor was frustrating. But the vendor's helping the patient directly. I thought that was pretty cool.
Yeah, that is interesting. I don't think we hear that very often, the direct vendor to patient relationship.
We've mentioned that we're starting to ask providers about the end user experience from both the office or clinical staff and the patient's experience. So maybe there's other ways we can start to validate how are vendors helping patients, or in addition to how are providers helping patients. So,
you know, it's interesting. I was talking to a provider organization today and asked them that very question. What does the ease of use look like for the patient using this technology? And it was a patient experience improvement vendor. And it was interesting. This provider organization thought about it for a little bit and kind of hemmed and hawed and wasn't quite sure how to answer it and couldn't really give a rating. But he said, you know what? The experience has to be good because we're getting more patient responses to our satisfaction surveys at this organization than we did from the last 2 or 3 organizations that he had worked at combined.
Oh, interesting.
So he just talked about the impact that's having on the patients and the barriers that are being removed by the tool.
So Dan, you just mentioned a study that we've kicked off, patient experience improvement, and not 20 minutes ago I took a call for that as well. I want to just talk briefly about that study. Why are we doing that? Do you want to highlight that for a quick moment?
Yeah, we're really excited about this one because we've heard from a lot of organizations that the standard way that they've measured patient satisfaction in the past of the surveys that you get a couple weeks post-visit or post-discharge are just not helping them move the needle fast enough. So we're seeing a new crop of solutions come up that are helping bring that patient experience improvement and patient satisfaction measurement to be more real time. So we want to go and find out from the market who's really being successful here, who's driving actionable insights for organization, who's helping them meet the needs of a specific patient in a more timely fashion, like you just alluded to, and how is this really impacting the lives of the patients and the experience at the organization. So we're excited for this one.
Yeah, me too. In a future episode, maybe we can share some of the results of that as they come in. One of my favorite questions we're asking is how actionable is the data that's coming in? Is it truly something providers can do something with? And so far, I'm hearing the very few calls I've had, they're saying, hey, this is actionable. We are able to do some things, which is great to hear. We'll see what comes out in the final tally, right?
Right.
Well, you know what? I have one more thing I wanted to highlight that I've heard this week. I think our listeners would find interesting. We're hearing, obviously, we're hopefully at the tail end of COVID. The story of the day is scheduling vaccine appointments and making that happen. This caught my eye online, this announcement recently of Uber and Walgreens launching a new nationwide vaccine appointment and ride scheduling feature. Good example of using consumerism. Uber's always used as an example. Look how easy it is to get a ride. I tapped my phone a few times. I think that's how it worked. I haven't taken an Uber in over a year now, but as we can recall, it's solutions like that make our lives easier. We love to see that concept come into healthcare. Have you heard of this as well?
Yeah, I think I've seen this on a commercial, actually, as I was watching TV lately. A celebrity trying to get people to help donate to supply some of these Uber rides to get people to their vaccine appointments. And it's interesting how innovative people are in getting people, especially those that aren't tech savvy or maybe don't have the funds to even know where to start. My mother-in-law, for example, she works in a retail store, and we were bugging her for weeks and weeks and weeks. She had been eligible for a while, and finally we had asked her, what's the challenge? And come to find out that she had no idea where to go, how to set up an appointment, and how to break through that technology barrier that you and I don't even feel, right? We see the technology as an enabler, but for her it was a barrier. And so things like this just really help move forward the cause of healthcare and what we're trying to do in a altruistic way.
That's cool. That's a cool example. Well, I think we should get to our guest right away. Dr. Rasu Shrestha, if I can just share a brief intro as we're about to welcome him in. He's the Executive Vice President and Chief Strategy Officer and Transformation Officer for Atrium Health. Before that, he was the CIO at UPMC. Just a wealth of knowledge and experience, especially on healthcare innovation, analytics, and patient-centered care design. I'm excited to ask him about that. So with that, we are very excited to welcome in Dr. Rasu Shrestha. Well, Dr. Shrestha, we're so happy to have you join us on the podcast. We absolutely appreciate you joining and sharing your perspective today. We're glad you're here.
Well, I'm glad to be here. Thank you. It's an absolute pleasure to be speaking to my class family. You know that I feel very strongly about the work that you do, and it's a real pleasure to be talking about something that I'm really passionate about with you and your audience today.
Well, thank you. We were trying to remember how many times you've been on our advisory board. You've been a longtime friend and supporter of class, and we hope your family's healthy and happy and doing well. And it's always great to have you join us. I know you've been to summits with us, and you always have something so interesting to share. So it's an absolute pleasure to have you join us.
Well, thank you. Yep, my family here is doing well, and it's been quite the year and a half, and I was talking with Adam Gale the other day, and we're, reminiscing on the era, before COVID, BC era, where we used to meet in person. We used to, have really intellectual conversations, not staring at each other on a screen. We used to have those human interactions, which I think are really important. But, I do believe, you asked about family, but I do believe that class is my family too. And, I've really enjoyed working with class over the years and being in the advisory boards for many years, and hopefully many more to come as well. I believe that you guys are on a class of your own, and the mission that you have in really bringing out the honesty, the truth, the specifics of, how do we navigate these choppy seas of healthcare. I see class as that lighthouse in the stormy seas of healthcare, and I think that's really important for not just provider organizations like ours, but patients, that we'll talk a little bit more about today, but also the industry overall, because I think that's really important, because oftentimes, we get lost in those stormy seas.
Yeah, agreed. And it's our pleasure to link arms with you. We know how passionate you are about some of these things, and so let's jump right to it, Rasu. You mentioned the stormy seas of healthcare. My goodness, unprecedented times. And with healthcare technology, especially evolving by the minute, it feels like, Talk to us a little bit about what you're doing at Atrium Health and some of the areas you are focused on as you navigate these stormy waters.
Well, it's really interesting. If you reflect back, the last couple of decades have really been about doing digital, right? And that's what KLAS has been tracking in terms of, performance for PAC systems and modalities and EMRs and clinical decision support systems. And so, technology has been, where we as provider organizations, we've gone out and said, hey, let's do digital. We're moving from analog to digital. But I really believe that, it's not really about doing digital, it's about being digital, right? So when you talk about healthcare IT, I think we really need to focus in on, look, it's not just replicating what was in the analog form factor and digitizing that workflow, right? Paper-based charts. Now we have e-charts, all right? E-folders, e-films, hanging protocols, wet reads. So even the nomenclature is a carry forward of the culture of analog, right? We're not hanging anything. The film's not wet. It's not even a film. Okay. So I think it's really important for us to not just do digital, but be digital. And by that, I mean, how do we think digitally? How do we work in ways that really frees us from some of the constraints of the analog workflow? So it's not just replicating analog and doing digital, but really being digital. So with that, some of the areas of health IT, just back to your question, that we're really focused in on is, I call it accelerating our digital acceleration path, right? Because, we're all in some sort of a digital acceleration path forward. Atrium Health has been a large organization that, had one of the most complex, one of the largest Cerner implementations across the board. And we're on a path forward where we're going from Cerner to Epic. And that's been really interesting. So that's been a big area of focus when I talk about our ambitions in terms of growth and getting at efficiencies, but also leveraging this learning health system construct across the organization. That's a really important element of enabling our, the digital acceleration pathway. One of the things that we did in the last year plus of living through the pandemic was we pulled together what we call our Atrium Health Rise and Reshape strategy. It's a bimodal strategy that says, how do we rise out of this hole that we're in as we're living through this pandemic, and how do we, as we do that, reshape the elements of what winning looks like coming out on the other side of this pandemic. So there are a number of things there, as it relates to healthcare technology in particular. In addition to the EHR rollout and the ambition to have a singular EHR platform across the Southeast and connect it to the specifics of other data elements that don't exist within the confines of the EMR, we're also continuing to move forward with expanding our footprint around cloud. So some of the things that you would expect for a larger health system like ours to continue to push forward with. But we also have multiple digital consumer initiatives that are underway to enable our consumers and our patients to, for example, easily find and select providers and locations for care, but not just through apps, but through enhanced experiences, right? About 2 years or so ago, I talked about how we were the first health system to really integrate the Alexa features and connect it directly to wait times in urgent care centers or EDs and such. So really looking at experience has been a big area of focus for us from a health IT perspective. We could go into deeper areas of this, but also enhancing our virtual care platform and really looking at offerings across acute and post-acute and ambulatory settings, but really rethinking even the paradigm of virtual care from, what it traditionally has been, which is it in-person care versus virtual care? And it's almost this binary on and off concept to more of a continuous care model. where virtual becomes part of care transformation and value-based care, and really focuses in on that person that's at the other end of that technology or of that screen or of that call. So a number of things that we're doing really across the board. But I think if there's one thread around all of this, it really is elevating ourselves above the silos that we've found ourselves in, right? Because the patient doesn't live in that silo. The patient really lives above the silo. And the stories that we're trying to carve around the patient and their journey really doesn't reside in any one of those silos. So how do we create a much more cohesive fabric of data and solutions so that we're really able to bring that patient story to life?
That is such an important perspective. As patients, we don't live in those same silos. We're thinking of our care and our needs, and I love that description.
You know, Rasu, as you talk about this patient-centric approach, your bio talks about your experience in patient-centric care design. Can you share with us some of the ways that you and your organization try to keep the patient involved and centric in your efforts?
Well, thank you. I appreciate that. You know, I talk a lot about how healthcare is really complex, right? I believe that in healthcare, complexity is the bane of our existence. The cure to this complexity is participatory design thinking that embraces the patient as a resource in the co-creation of these solutions. And I think we oftentimes forget that. You know, oftentimes we, for example, work with a vendor to turn on a solution, and what we oftentimes do is we engage our end users, whether it's a patient or a clinician, for that matter, around the go live time, and we say, hey, here's a cheat sheet. For physicians, we're buying pizza, whatnot. We have a launch of that solution. That's oftentimes the first time that you've engaged that end user around any element of that solution, and that's just absolutely wrong. So it's really critical to involve end users, patients in particular, as early as possible, as often as possible, and have them be an iterative part of that design process through and through. So one of the things that we've been really pushing for here at Atrium Health is, by starting with the consumer and the patient, we can really get at solutions that arise that are not only profitable and scalable, but they can also have the impact on the ground that our patients and providers really need. So when we look at a problem through the lens of consumers and patients, we're suddenly able to open not only our minds, but also our hearts, which I think is really important, because oftentimes we're very transactional in the way that we've been running healthcare. In the last couple of decades, as we've been doing digital, as I talked about earlier, the focus for healthcare overall has really been transactional. And I really think that we need to elevate ourselves from the transactional elements of providing healthcare, HL7 messages, billing, coding, the interaction that you have in episodic care opportunities with our patients, to more of a experiential layer, right? Going from transactional layers to experiential layers. And I think that's where, some of the elements of the design thinking, the participatory design thinking models that I talk about really come into play.
That's great.
It's interesting, as sometimes as HIT professionals, we get a little caught up in our own environment. We think we can put on our patient hat, because we're all patients, and think that we're doing patient-centric things when we make our decisions, but that comes with some inherent bias, as we know the technology landscape, we know what things have looked like before, and it's a good practice to pull in that outside patient perspective that has none of that bias.
Absolutely, yes, exactly right. Yeah, you've all seen that cartoon where it says patient-centered care, and you've got the patient in the center, and you've got one physician on one side looking at their charts and the other physician on the other side looking at a computer screen. So the patient is in the center of those two physicians, but the clinicians have their back to the patient, and that clearly isn't patient-centered care.
So think with us on a broad level Where do you think healthcare needs to go to be more patient-centric? You've given some excellent examples how you're trying to involve the patients, but maybe there's examples outside of healthcare you think, hey, that could work well here. Have you ever considered any of those, and if so, what might they look like?
Yeah, it's a great question. I try to bring in a lot of outside in thinking, and even in the design or the reimagination of what healthcare could and should look like. And we don't need to look far, because we interact with these industries every day when we switch on our TV at the end of a long day, and maybe try to select our favorite Netflix episode of any show for that matter, or when we go in and engage online on Amazon, and we try to essentially go and buy anything perhaps on Amazon for that matter, or we interact with the financial institution, right? No one goes to a bank anymore. Maybe you via Venmo send a payment to anyone, maybe your child's tutor, or the gardener, or your so there are all these experiences that other industries have, I think, masterfully tackled that we can learn a lot from in healthcare. I think if we parlay that to one thing in particular in healthcare that I believe we can maybe rethink or reimagine or maybe even reframe. We've been talking a lot in class and in health IT circles about interoperability, right? And we've gone through a lot in terms of, I call it the crawl, walk, run phases of interoperability. And I'm the half glass full, healthcare executive here, who's also a clinician by background, and I think we're at the run stage of interoperability, but we've been through that crawl walk stages as well, right? Crawl, where healthcare applications, EMRs, didn't talk to each other. They had standards of their own, proprietary standards that just didn't interoperate with each other. And then, a decade after that, so this last decade, it was more of a walk scenario where there was more interoperability. Healthcare IT vendors were adopting more of the national standards, like RxNorm and SNOMED and such. And I think that created more opportunities for data to interoperate. And now with more open APIs, with standards are evolving like HL7 Fire, et cetera, there's an opportunity for us to really run in interoperability. But I think if we learn from other industries, perhaps there's an opportunity for us to really pivot and flip things around to where, could we make patients the arbitrators of their own data? Could we really have patients be front and center in this difficult task of interoperability that we've been struggling with for the last couple of decades? And if we could really empower our patients to have control of their data, what would that model really look like, right? So it's almost an outside-in thinking of flipping of the script, so to speak. Because I believe for the longest time that innovation done right makes technology invisible, right? And if we could really empower the patient, charge them with their own data, but really meet them where they choose to meet us, and give them the opportunity to really be the arbitrators of their own data, right? What would that really look like? What would that look like for the patient, their circle of trust, the caregivers that they really surround themselves with? But yeah, that's something I wanted to share with you today.
Thank you.
That's great. Have you had any examples that you've seen in the industry specific to healthcare? Any patient-centric technologies that have stood out to you lately as you've been looking at the vendor landscape? Or I'm sure vendors are always in your ears, and your fellow peers on the provider side.
Yeah, no, absolutely. So lots of examples that I could quote. I talked about moving from transactional to experiential in healthcare, and I think that's really important. In the experience economy and the current era of consumerism, healthcare entities that maintain a supply side mentality will, I believe, not remain competitive. And there are a slew of technologies that are evident of this shift, and many are improving the experience for both patients and providers, which I think is the true win-win that we should really strive for. I'll give you an example. I don't know if you've heard of Baby Scripts. It's a digital health solution that enables providers to offer virtual maternity care to moms-to-be. And I think that's a really critical population, right? So, we're here in the Southeast, headquartered out of Charlotte, North Carolina. Charlotte is one of the fastest growing cities in North America. Lots of moms-to-be's right here. And when you then think about the Southeast overall, lots of opportunities for us to get it right in terms of that experience. And so through their digital solution, they engage these moms-to-be in their maternity care in what we call the rhythm of their lives, where it is most convenient for them. So it allows for a number of different things in terms of even things like remote patient monitoring, allows for low-risk moms to reduce the number of visits they make to our offices, right? Really enhancing their experiences. If they don't need to come into the offices, why, in the heightened state of the complex journey of pregnancy, why have them visit us? Additionally, for those patients or moms with hypertension, for example, Baby Scripts allows for more continuous monitoring and more longitudinal data that can be provided to our providers, right, in a much more automated way. And that experience, I think, is really, really important as well. So what we're trying to get at here is, look, it's not just picking at a specific population that we can really have a lot of impact in, but really having solutions like Baby Scripts where we're saying, all right, how do we really elevate the experience to another level? How do we make sure that we're able to make the technology element of this as invisible as possible, as I was saying earlier, where the flow of data and decisions between the patient who doesn't reside on the EMR, they might reside on their smartphone at best, and the clinician who does oftentimes reside on their EMR. How do we really create that level of bridging between those two divides, those two worlds? So using solutions like Baby Scripts that run on top of, at least in our environment here at Atrium, Xealth, which is more of a back-end solution that marries those two divides between the physician's EMR world and the patient's world around devices and smartphones and such. We're really able to enhance the experience, whether it's for moms-to-be, leveraging Baby Scripts, or other patient populations where we can really make a big difference.
That's a great example. Rasu, I'm curious if you have any other advice you'd give our listeners as they try to navigate these waters and really truly focus on the patient. Is there anything else beyond what you've already shared today that you think, this is what I would say if I was talking to all my colleagues at once?
Sure, yeah. So I'd say, but first, empathy, right? In any conversation that you're having, whether it's with your chief supply chain officer, whether it's with your CFO, whether it's with a patient, whether it's with your clinicians, but first, empathy, right? I truly believe in the trifecta of innovation, inclusion, and impact, right? So it's not just innovation for the sake of innovation. It's being very mindful of, are we including the right folks? What does that really look like, right? The patient's voice, the challenges that we've really seen come to light even in the pandemic that we've been living through, between the haves and the have-nots, the digital divide that exists in between. So inclusion is really important. And then impact. And how do we make sure that we're really not just doing innovation for the sake of innovation, or design thinking sessions, listening sessions with patients for the sake of checking a box, but impact? What does real impact really look like? So I think that's really important, and we've really been embracing those methodologies in the work that we've been doing. Let me give you a quick example here, right? So even in the last year plus, one of the things that we quickly realized was, the gap between the haves and the have-nots, especially in the Southeast where Atrium Health resides, is quite stark, right? Charlotte is one of the fastest growing cities in North America. It's the second largest financial hub right after New York City. Yet it is also number 50 in the top 50 metropolitan cities for upward mobility, meaning if you're born poor in the greater Charlotte area, chances are you'll remain poor. So one of the drivers for me, even to move to Atrium Health, has been to work with a stellar team here to make some impact in that. And in the last year, what we've been doing is really leveraging the power of empathy and listening, right? So we've had lots of listening tours. We've really sat down with patients and community leaders and others, and we've been able to really rise to the challenge, almost overnight in things like managing the gaps between, various zip codes as it relates to access to care around COVID and COVID resources, right? So we've been able to use analytics and GIS capabilities and almost overnight send in our mobile testing units, leverage some of our point of care ultrasound devices, have remote locations that, create specific access capabilities to patients in more underserved communities and really flatten the disparities between the haves and the have-nots in those zip codes that we're talking about. And the same thing got carried forward in some of the mass vaccination efforts that we were pushing forward with, right? So for us to really lead the charge around some of the public health domains where we've been able to, over a 24-hour period, vaccinate over 20,000 people, right? It's almost like a shot every 4 seconds. It's just really remarkable, that level of efficiency. But where we've also been able to target, underserved populations, 21%. In one of the mass vaccination efforts that we're doing, 21% of the patients that came in were people of color. And our goal continues to be where, we really want to, live up to our mission statement of health, hope, and healing for all. So that level of really leading first with empathy, listening to not just what our patients and our communities are saying, but also what they're not saying. I think that's really important, and that's something that I, just wanted to share with all of your listeners as well.
That's fantastic. But first, empathy. What a great message to remember. So,
yeah. This has been really fun to talk to you today, Rasu. We want to end with a kind of a fun question, and first I want to share an experience. One of my favorite memories of you, and please correct this story if I'm misremembering, but years ago, you were here in Utah at a class event, and you were sitting on a panel, and we had asked a question about what the panelists were reading those days, what had stuck out to them, and you shared, I noticed you're wincing a little bit, but you shared that you were reading Captain Underpants with one of your kids. And I just love this, an HIT professional, you have such demands on your time, but you were taking time to read a fun book with one of your kids. Anything fun you're reading today, or anything that sticks out to you as you're better yourself?
Yeah, no, absolutely. I've graduated a bit from the Captain Underpants series. No, absolutely. So my boys just love that series for sure. And it's interesting. I shared that because that was the last purchase that I'd made, and something that I'd really indulged in. I could share with you two books that I've been really sort of sinking myself into of late. One is kind of a heavy book. It's by Ibram Kendi, and some of your audience members here might have read this already, but it's titled "How to Be an Anti-Racist," and I think it's a must read. It's a New York Times bestseller, and it's really important for us to understand that the only way to undo racism, as is written in the book here, is to consistently identify and describe it and then systematically dismantle it. And even in what we've seen in the last year, where we've gone through so much as a nation, I think we still need to do more to really understand the root causes of some of these disparities that we're seeing, some of the gaps that I was talking about earlier in terms of the haves and the have-nots, but also the culture that we're swimming in as a nation here, especially if we truly do aspire to live up to the reputation that we have of being, this forward-leaning, innovative country that really cares for our citizens. So I know that's a heavier topic than Captain Underpants, but it's something that I did want to share. The other book that I am just starting to read right now, and I'm loving it, is by Daniel Dawes, and it's called The Political Determinants of Health. And it's a remarkable book. It's lighter. It's only 200 pages, but it talks about a number of specific elements of what it means to really navigate healthcare as we know it today, and the politics and the policies that oftentimes determine what we can or cannot do or should not do in terms of healthcare. So I think it's a really important read, because as we've seen even in the last couple of years, politics and policies oftentimes determine the specifics of how healthcare plays itself out. Even in the pandemic, in the first year, the number of deaths that we saw across the United States directly attributable to COVID-19, I don't think we should ever have experienced that as a nation. I think we should have definitely been much better, much more proactive. Nowhere were we talking about syndromic surveillance at a national level. And again, I'm very aware of some of the debates around privacy and security, but I think there are real ways that we can go about managing public health crises of this nature, if we're able to really put politics aside and focus on what's important for that person, for that patient, for that community that we're really in service of. So two slightly heavier books than Captain Underpants, but nonetheless, I think two really relevant books for the climate that we're swimming in today.
Great recommendations. Thank you. We appreciate hearing your perspective. Well, Rasu, we know you're busy. We know there's a lot going on, and we just want to thank you for your friendship and partnership in advancing healthcare. It's very clear to us how important these things are to you, and we're glad you're part of the class family, and thank you for all that you're doing. It's an absolute pleasure to have you join us, so thanks again.
Well, thank you. Thank you for having me today and this amazing conversation that we just had, and let's keep at it.
Sounds great.
Sounds great.
Thanks.
Well, Adam, that was a really fun and insightful conversation with Rasu. You never quite know what to expect, but he always brings some great insights and very memorable quotes. Did any of them stick out to you that he had said today?
Absolutely. I loved when he said, patients don't live in the silos that we create. Boy, that just painted a clear picture of, we try to create these efficiencies in healthcare that we think are efficiencies, and there's administrative goals and efforts made, but do we truly think of the patient across those silos? That really stuck out to me. I really enjoyed that.
Great. Well, we'd like to thank, again, Dr. Shrestha for participating with us today. We'd like to thank our colleague Jeff, who helps put all of this together, and all of the rest of the class family that helps collect this great research and helps hold us accountable to amplifying this patient voice. So if you have any ideas for future research or future topics for this podcast, we'd love to hear them at patientengagement@classresearch.com. And Adam, I know you love to close these podcasts with a quote that you found, so why don't you share what you have today?
Okay, I've got one in honor of me not getting Garth Brooks tickets recently. It sold out too quick. But he has a song that I love. I'm not going to sing it, called The River, and there's a phrase in there that made me think of our podcast. He says, don't you sit upon the shoreline and say you're satisfied. Choose to chance the rapids and dare to dance the tide. Love that one. The reason I wanted to share that, Dan, a little different from our past quotes, healthcare is hard. It is tough. Engaging patients is really tough. And doing all of that in the middle of a pandemic is so difficult. So just as a little shout out to the provider healthcare heroes that are trying so hard to figure this out, keep going. You can do it. We're all trying to figure it out together. So there's the quote.
What a great quote to end on. Thank you, Adam. And thanks to all those who listened today. We look forward to being with you again on a future episode.
Thanks.